Now, live with Greg Olsen, Director of the New York State Office for the Aging.
Well, good afternoon, everybody. I'm so glad you're joining us today. For those of you that don't know, well, you know I'm Greg Olsen from the State Office for Aging, but what you may not know is that March is National Nutrition Month. The New York State Office for the Aging administers the largest nutrition program in the country for older adults, providing over 22 million meals to more than 247,000 older adults every single year. In fact, and check this out, since 1975, this network has served more than 1 billion meals to more than 10 million older adults. But nutrition is so much more than just a meal. Food is medicine, but we're going to explain so much more of what the New York State Office for the Aging and our community partners do every single day to ensure the nutritious value for older adults in New York State. But before we do that, I would be remiss to say, in addition to the paid staff, we would not have a nutrition program like we do without the countless number of volunteers who deliver meals, who prepare meals, and who also staff and provide meals in congregate settings. Check this out. So I'm really excited again to have this production today because it really gives me a chance to showcase three extraordinary people that work at the State Office for the Aging, the talent, professionalism at our State Office for the Aging in supporting the agency's mission, which a huge part of has been the nutrition program. In fact, many state units on aging back in the late 60s and 70s were born out of the need for the nutrition program. So for today's program, I'm so pleased to have joined an exceptional team at the State Office for the Aging responsible for the nutrition program and some other things you're going to learn about today. First, we have Tianna Pettinger, Lisbeth Irish, and we have Wendy Beckman. And I want to have a special shout out to Jennifer O'Keefe, who is not with us here today. So let me start with each of you because you all have kind of a different role for the nutrition program and various aspects that we're going to talk about today. And tell us a little bit about yourself. So Tianna, I'm going to start with you, then we'll go to Lisbeth and then to Wendy.
Thanks, Greg. So as it says underneath my face right now, I'm an MSW, which means I'm a social worker. So my focus in terms of our nutrition program is more on the administration and coordination of the program, some policy work, and just supporting our nutrition staff, both at the State Office for the Aging, but also our programs at the local level.
Lisbeth?
Hi, I'm Lisbeth. I'm a registered dietitian and I manage NYSOFA's SNAP-Ed program, which serves 9 different regions in New York State. And I'll tell you a little bit more about that later.
Perfect. And Wendy?
Hi, Greg. My name is Wendy Beckman. I'm a registered dietitian, and I am an aging services nutrition consultant. So that means that part of my job is to visit County Office for the Aging, and I oversee their nutrition programs, and I look at their menus, and I look at their operations to make sure that they're safe. And we'll talk more about that later also.
So a couple of different things. Let's just get started in some of the credentialing. And, you know, Tianna, I'm an MSW too, something we should be extraordinarily proud of. But we have 2 registered dietitians, and Wendy is an RD and a nutritionist. So either one of you or both of you, what's the difference between an RD, registered dietitian, and a nutritionist?
A registered dietitian must have a minimum of a 4-year degree in nutrition or dietetics. Have to do a 10 to 12 month supervised work experience, which is called an internship. You have to take and pass a national exam, and you must take 75 hours of continuing education every 5 years. The term nutritionist is regulated in some states, but in New York State, it's not regulated. So anyone can use that title. It doesn't require any credentials.
So when you say anybody can use the title nutritionist, somebody like me, I could call myself a nutritionist? Really?
You sure can.
All right, so these programs are great because you learn something new every time. So Tianna, we often talk about the phrase "more than a meal," and I think that is so true in terms of what it is that we all do collectively, not only at the state but at the local level when we're talking about the program. Talk a little bit more about that, if you could.
Thanks, Greg. So yeah, and we have a slide that kind of speaks to this as well. So of course, a meal from our program is more than just being food. So the nutrition is to support health, and all our meals are nutritious by regulation. But also eating a meal is an experience you can look forward to, could be the highlight of your day. You can enjoy texture, taste, color, smell. And when any of us have a meal in front of us, it's an empowerment. We get to make a lot of choices as we decide how to eat that meal. Some people like to, even at my family dinner table, some people rotate, right? Eat all of this and then eat all of that. Whereas I want to put a little bit of everything on my fork at the same time and combine the flavor. So, people get to do what they want with how they're going to eat that meal. And food for all of us is really a connector to ourselves and our past, our ancestors, traditions. And then the other thing we're really proud about with our meal programs is that they create connections to other people, right? So you might be sitting around a table with other people at a community site, or there might be someone knocking on your door with your meal in hand every day, mid-morning, and they get to chat with you. You get to smile together, have a quick joke to share with you, or just ask how your grandkids are, that sort of thing. And that might be the person you get to talk to face that day. And everybody looks out for each other at our program. So, if something doesn't seem right, our drivers, for instance, have saved lives by taking action when something didn't seem right with someone. So those are a lot of the different ways it's not just about the food.
Yeah, and I'm going to come back to that in a second. I'm glad you kind of did that review. There's really 4 components to our nutrition program. There's congregate meals, home delivered meals, nutrition counseling, nutrition ed, and then there's a couple other pieces we're going to talk about. Let's talk a little bit about congregate meals. We have almost 800 congregate sites across the state of New York. So, tell people what congregate meals are. And I want to let folks know that are watching that all the pictures of the meals that you see, these are not stock photos. These are actual meals that are produced for our nutrition program here in New York State.
Yes, good point, Greg. Most of the pictures were taken by Jennifer O'Keefe, and the reason why she's not here with us today is because she's out on site again, taking more pictures of food, visiting a AAA and seeing what their congregate meal program is doing, going on a home delivered meal route, checking out the kitchen. And I thought it would be interesting to share with everybody. I looked up the site that Jen is at today, conducting a visit, what their menu is for lunch. So everybody there today is starting off with a soup. And at that site, that's a tradition that they always start every meal with a soup. Then they're going to have meatloaf with mushroom gravy, orzo primavera, Harvard beets, and an apple. So that is today's menu, March 14th, 2024, where Jen is today. So the congregate meals, the word congregate just means basically in community. So you're eating with others in community, both meaning in a group setting, but also you're in the community, literally. You might be at a firehouse, at a church, at the town hall, at a community center that has been designated as a meal site. Oftentimes there's a transportation program that can get you to the meal site and back home again. And in addition to the meal, a lot of these sites have other things going on. So while you're there, right, take an art class, take an exercise class, play a game of pool, play a game of cards, get your blood pressure checked, all sorts of things, right? And by definition, if it's a congregate meal site, there's going to be regular presentations on healthy eating and wellness and good tips for folks. And one of the things we want to make sure folks know is if you're 60 or older, you get to go. You get to go to a congregate meal site. There's no additional eligibility criteria. And in fact, you can bring someone younger with you and they just pay their way at the site, but they could go too. And everybody has an opportunity to contribute to the cost of that meal that was provided to them, but there's no fee, there's no set fee. So, whether or not it's affordable to someone isn't a barrier. That's not a factor. So you contribute what you want, what you can, what you choose, and go, as many days a week as you want. And you can attend the closest site to where you live, or you can attend another site, maybe near where your friend lives, and you're going to meet up with them there.
Yeah, and I appreciate you saying that. I mean, we spend a lot of time here trying to make connections to combat social isolation, and congregate sites are and home delivered meals and some of the other things you're talking about are really gateway services. And what I mean by that is, you may go for a meal, but as you said, there's an opportunity for classes, for pottery, for games. We had the reach out and play events at many congregate sites, but it's also an opportunity to connect people with other things they may not need that they may need that they don't talk about. I've been really fortunate over the last 33 years to visit hundreds of congregate sites in senior centers, housing authorities, as you said, firehouses, et cetera. And I think people have a misconception, especially if it's in a senior center, of what actually goes on within a senior center. So I'm going to tell folks, check these out. There's a lot more than just congregate meals, and many of them are extraordinarily active and an opportunity to really make friends and broaden your horizons. I'll be at the Amherst Center on Monday for one of our March for Meals events, and they have over 16,000 members because they're offering all kinds of things for older adults to engage and broaden their horizons. So, Wendy, you've been to a lot of congregate dining sites as well. Anyone really stick out for you in terms of something that just is in your mind that was really just extraordinary?
Well, I have been lucky enough to visit congregate sites all throughout New York State, and there was one in the Amherst area that was beautifully decorated to look like a 1950s diner, and that absolutely stood out to me. But I've gone to congregate sites in very rural areas as well. I remember one that I went to that was in a church, and it was sort of what some people would consider the middle of nowhere. But there were about 25 or 30 participants there, and they were a very close-knit group. And I was being told by the manager there that, on occasion, they sort of get together on their own and they go to a local restaurant or diner and dine together there. So that's how close that group of people was. So, there are congregate sites all throughout New York State in every single county. So people should, if they're interested in going to a congregate site, reach out to your local office for the aging. They can tell you where the congregate sites are in their county. Or if you like to check things on the computer, most office for the aging in each county, they have a list of their congregate sites on their website.
Oh, great. And there's the New York Connect. So anybody can call that. You'll be routed directly to your local office for the aging for exactly what Wendy said. Wendy, I want you to reiterate again what Tianna talked about. Who can go and what's the cost?
So each county has their own contribution rate. So as Tianna said, there isn't a required contribution, but people are encouraged to voluntarily contribute. No one is turned away if they're not able to contribute. So anyone 60 or older and their spouse may go to a Congregate site in New York State. There are lots of, again, each county is different. So some Congregate sites have lots of different activities going on, at the same time or on different days. And then, other counties may have it structured a little bit differently. So these pictures here are some beautiful pictures of actual Congregate meals. So they are nutritious. They are required to meet 33 1/3%, or a third of the dietary reference intakes for Americans. So anyone who goes is going to know that they're going to be getting a nutritious meal that is low in fat, low in sodium, but is still going to be delicious.
Okay, so let me dumb down some of the things that you said for people like me. So anybody 16 over can go. If you are, let's say for the example, if I'm 61 and my wife is 55, she can go for free. If you're under 60, you can go and pay the actual cost. There is no cost, though. They ask for a voluntary contribution. That's really important. Let me tell you what that actually means. In 2023, just through voluntary contributions of a couple dollars, right? The network raised $16 million. And what happens to those dollars? They go right back into the program to be able to provide nutrition for those that can't afford it. So it matters, but it's not mandatory. So I just want to be clear on that. Wendy, we have another meal program, again, a huge one. Everybody references it as Meals on Wheels, which, as you all three know, drives me crazy because Meals on Wheels is a national organization. They do tremendous work, but it's a brand, no different than Dunkin' Donuts is to coffee. We have a home delivered meal program, and it's absolutely huge with over 2,000 home delivered meal routes. Talk a little bit about that.
Right. So some individuals will qualify to receive home delivered meals. If an individual contacts their Office for the Aging, they want to have home delivered meals, they will have an assessment. And if there are any barriers to either preparing food or purchasing food, being able to get out and about to buy food. Maybe someone has difficulty preparing food because they can't handle a knife, or that they don't see well, or they don't have adequate facilities in their home to prepare meals. All of those are barriers to having nutritious food on a regular basis. And in those cases, if that individual is going to benefit from home delivered meals, then they would qualify for them. They are also are given the opportunity to voluntarily contribute towards their home delivered meals, but it's not a requirement. And, it's a great program to help people stay in their homes. If we know that good nutrition, and older adults in particular who have good nutrition stay out of the hospital, they fall less often, they control their diseases that they have there, and they take their medications more often if they're able to have nutritious food on a regular basis. So it's so important for longevity and quality of life. It's a great program.
It is. And so again, just to clarify, so the Congregate is, there's no cost. Home delivered meal, there is an eligibility criteria, and Wendy talked about that. Difficulty in shopping and preparing meals and not having somebody to be able to help you do that. So that's the qualification, but then it's similar. But I want to go back to something Tianna raised that is critical. People think, you're just delivering a meal. This is a really, really important health and safety check for older adults. Our average home delivered meal client is an 81-year-old low-income female that lives alone, has multiple chronic conditions and functional limitations. And I know I can, and you guys can too, tell countless stories of how the trained home delivered meal driver saved a life. Talk about that, please.
Yeah, so the drivers really get to know their clients, and oftentimes when they're delivering the meal, they may pick up the mail for that person because they know that their client has difficulty walking to the mailbox. If the home delivered meal driver goes to the door and no one answers, they have a procedure that they follow. They call the office. They have someone their emergency contact for that person is contacted to make sure that the person is okay. And there have been countless home delivered meal drivers who have found individuals who have fallen or were unable to get up. They couldn't answer the door. And many times there are people who don't have someone else who's checking on them on a regular basis. So those home delivered meal drivers put their eyes on that person. They have face-to-face contact, and they make sure that that person is okay 5 days a week.
And for many of the recipients, the driver may be the only person they ever see. Yep. So there's that interaction. We have had stories from counties of older adults that have wandered out in the winter and been found in the backyard, for example. And I remember one specific story because we honored this couple up in Franklin County that were delivering on a rural route. And on their way back, they saw smoke coming out of a trailer. They pulled the husband, who was obese, and the wife out of the trailer, and it burned down 5 minutes later, literally saved their lives. And so I want folks to understand, the folks aren't coming by, leaving a meal out at the front door. As Wendy said, there's protocols. It's a really, really important health and safety check. So Lisbeth, let me move on to you. You've worked for a long time, a registered dietitian, and providing nutrition counseling. We talked about the 4 components: nutrition counseling and nutrition ed. Talk a little bit about what nutrition counseling is.
Nutrition counseling is one-to-one nutrition information that's tailored to the individual. When I do nutrition counseling, I spend a lot of time getting to know the person. I ask a number of questions about how they eat, questions about their health, what they would like to change about their diet, and anything else I think might help me explain the evidence-based nutrition recommendations that would improve their health. When I provide those recommendations, I try to break it down for the person so the changes they want to make are manageable and realistic. And I also make follow-up appointments available to the person so I can guide them along the way.
And that's a critical service. What are the things that you normally see, the common nutrition issues, concerns, and so on? And I really want you, I'm going to add on to this. I don't mean to throw you a curveball, but one of the huge mistakes in the Medicare program is not providing dental health and how that impacts good nutrition.
Mm-hmm.
Dental health is huge. If you can't chew your food, that creates a risk for swallowing issues, which can turn into pneumonia. Being aware of those and learning how to adapt. Sometimes registered dietitians will consult with speech language pathologists to find out what the best texture would be for a person, whether they're safe with solid foods and with liquids. It can be a huge influencer of a person's health. We also see people with diabetes, people that need to manage their blood pressure, their risk for heart disease, intestinal issues, food intolerances, how to help people manage their weight, their poor appetite. There's countless ways that a registered dietitian can intervene and also provide referrals to other professionals if a person has nutritional issues.
Yeah, we also, as Wendy was talking about earlier, there's an assessment required for a home delivered meal. We know the folks on our caseload that have hypertension and diabetes and other chronic conditions, where the work that the 4 of you, because Jennifer is not here, and all of the RDs and nutrition program participants across the state can really have a positive impact on those chronic conditions, which
Yes.
Are going to cost the United States almost $1 trillion by 2040 that are preventable, but more importantly, manageable. And that's what you're talking about.
Mm-hmm. Yes, malnutrition is a huge factor. My own father had a downward spiral. He stopped eating. And it took us months to get him back, to where he could live on his own again.
Yeah, well, I'm glad you were able to do that. Tianna, so partnership is the name of our organization's game, right? Because if you don't have partnerships with other state, local agencies, and not-for-profits, you can't do the job that you do. if you live outside of New York State and somebody says New York, they think of New York City. However, we all live in New York, and we have 42 counties that are statutorily defined as rural. So all you have to do is drive around, and what are you going to see? You're going to see farms. We are a huge agricultural state, and we work very closely with the Department of Agriculture and Markets, New York State. There's another program that we administer that in the spring and summer, extraordinarily popular to get our agricultural products, which are really good and very nutritious, into the hands of older adults. Talk about that.
Thanks, Greg. I was just remembering I attended a training once, and the speaker was saying, if you're wondering whether you eat enough fruits and vegetables, basically the answer to any American is you don't eat enough fruits and vegetables, right? I'm a vegetarian, and when I was learning that I was supposed to have half my plate always be fruits and vegetables combined, I was like, oh my gosh, I'm a vegetarian and I don't eat that much of my percent of my plate fruits and vegetables. So the program we do with Ag and Markets is a great way to increase fruit and vegetable intake. And yes, when the farmers markets come out across New York State, it's beautiful. The colors you can see in the picture here, the variety, the freshness. But it's not cheap, right? To buy really great fresh fruits and vegetables. So what we do with this program is there's funding. Most of it comes from USDA, and Ag and Markets administers it, but we're their partner. Like you said, partner is important to get this benefit into the hands of older adults all across the state. And so older adults that are eligible can get a coupon booklet to use for the season at the farmers market. And they have the choice. They can spend that all at once. They can spread it over 5 different purchases, because it comes in a set of 5 coupons that are worth $5 each. And so you can go 5 different days, 5 different vendors. You do what works for you. And the folks who are eligible are, like our other programs, going to be age 60 or better. But this one, unlike the others, does have an eligibility criteria around income. So you need to be at 185% of the federal poverty level or below, which is a very common eligibility criteria level. So if you're eligible for other programs based on income, you're likely eligible for this program. And the only thing you do is kind of sign that that's true for you. There's no documentation. You don't have to show up with a pile of all your bank statements or anything. So the AAAs handle this distribution of the coupon booklets. They work with community partners to have reach into their whole county level. One of the nice things about the program is it's not always possible for every older adult to physically get to a farmer's market and do the shopping and carry those things back home. But they can obtain the coupon booklet, and then their daughter-in-law, who maybe goes to the farmer's market anyway, can grab one of their coupons, ask them what they want that week, and get the things for them on their behalf. The older adult doesn't have to be the one in person doing the shopping. And the season starts July 1st. That is the earliest date the coupons can be distributed. And a good kind of gateway for getting more details about where the distributions are going to be and on what days in your county is by using that same New York Connects number you would use to ask about where the Congregate meal sites are.
Yeah, thanks, Tianna. Now, you mentioned the AAAs. Are you talking about the Automobile Association of America?
Yes, we're guilty of that all the time. So that's our abbreviation for Area Agencies on Aging, which is the term used nationally in the Older Americans Act for basically your local office that deals with aging. And it almost 100% of the time in New York State is a county government office. So you can look it up, search by your county, and it's going to be right alongside the other county offices and on their website and in the listing. And certainly when you call New York Connects, we ask you what county you live in, and we get you right to them.
Yeah, thanks for clarifying. There's too many acronyms when we're in the business. And, I learned a while ago that we got to spell them out. And I just want to, shout out to Commissioner Richard Ball, who's he's a farmer in Schoharie County, but the Commissioner of Ag and Markets, and his staff, who have just been tremendous partners for not only our agency, but really helping to increase access to all the amazing agricultural products we have here in New York State. So, Lisbeth, let's go to some more acronym soup. We have something called SNAP-Ed. So I'm gonna actually say what SNAP is. It's a Supplemental Nutrition Assistance Program. A lot of people know that what SNAP does is helps individuals buy food, and the average amount that an older adult in New York State gets is around $200. But talk a little bit about what SNAP-Ed is.
Well, NYSOFA's SNAP-Ed program is designed specifically for older adults, 60 years and older. And our program serves 25 counties, 2 tribal nations, and the 5 boroughs of New York City. And what we do is we offer adults who are SNAP recipients who are eligible for SNAP no-cost workshops taught by nutrition educators. These workshops teach you how to make healthy choices while at the same time saving time and money. And the information they provide is accurate, it's easy to understand, and most of all, it's fun. Our educators are great. And our educators also partner with other community organizations to help older adults access healthy foods. One of the ways they do this is through food box distributions, and these are generally seasonal distributions of fruits and vegetables, which are low cost or no cost to SNAP eligible older adults. Many times we coordinate our programs with the Senior Farmer Market Nutrition Program coupon distributions. So, it's a one-stop kind of thing.
It's amazing. I think you saw some of the data. Alex, if you could pull that up again on how many people have been reached. It's really a fantastic program that's embedded all throughout the community. And again, have to shout out to all of our friends at the Office of Temporary Disability Assistance who partnered with us years ago, as well as local Cornell Cooperative Extensions. And we're hoping that we can continue to expand it over time. But, you can see the link there. Check out the programming on Facebook and YouTube. Now, Wendy, this is a stick in my craw here. I like to think that we get a lot of people watching this show, which we do. But as part of SNAP-Ed, a show was created called What's Cooking? Well, first it was What's Cooking with Wendy, and now it's What's Cooking with NYSOFA. It's now had over 1 million views. So congratulations on that, and to the entire communications team. Let's talk about that for me.
Sure. So over the pandemic, we were looking for ways to engage with people and keep them up to date on nutrition information. And our communications team sort of came up with the idea of, doing a cooking show. And my first thought was, I don't want to do that. Like, I don't want to put myself on the internet and do that. That's kind of a weird thing to do. But then I saw some other SNAP-Ed programming that other people were doing in the middle of the pandemic, alone in their homes with their cell phone, recording themselves and recording some really good content, really good nutrition education. And when I saw that, I thought, oh, right, if they can do it, I can do it. So we started streaming What's Cooking with Wendy, from my living room, using my iPad as the streaming device. And it was a lot of fun. I had a lot of help from the communications team to make it look as good as it possibly could, streaming from my living room. I used my phone as an overhead camera so that people could see what I was doing on the table in front of me. I wrote my own scripts. I used a tablet to sort of scroll my script while I was trying to cook at the same time. So we did that for probably a little over a year. And after things started getting back to normal and things started opening back up, our communications team again came to me and said, we really think we could make this look better. So we partnered with the Office of General Services, New York State Office of General Services, and they have an amazing team of individuals who come in, and several times a year we film the cooking demonstrations in a kitchen that's located in Rensselaer County, and unfortunately it's not my kitchen, but it's a beautiful spot, and we have several different cameras and the lighting and the sound crew and everything. And it's really wonderful to work with those people. And we were able to really increase the quality of that programming. And the messages that are in those cooking demonstrations, it's not just the food and what we're cooking, but we talk about nutrition education. We do nutrition education at the same time. The goal of SNAP Ed is to help to teach people how to eat healthy on a budget. And everyone needs to know how to do that, not just older adults, everyone, especially nowadays when the cost of everything is increasing. So I talk a little bit about the ingredients that I'm using and why you want to include those ingredients in your diet. And what are the health benefits of the ingredients that we're using today? And why are those beneficial, in your diet? And we talk about the messages: make half your plate fruits and vegetables, make half your grains whole grains, switch to low fat or fat-free dairy, and to vary your protein routine. And those are the main messages. And I sort of build those episodes, those cooking demonstrations around those messages. And it's a lot of fun. It's a wonderful project. And I am so happy and privileged to work at the New York State Office for the Aging with some really great management who, when confronted with, hey, we want to do a cooking show, I heard, yes, let's do that. Let's go ahead and do that. That's not your job. Don't do that. So I'm a lucky lady.
Yeah.
Well, I think it's fantastic. And we're lucky to have all three of you and Jennifer, who's out in the field right now. Alex, can you pull up the YouTube and Facebook again? Because I was wrong. It's 2 million hits, and I will never be able to compete with that. But I'll tell the audience this, and I'll tell you that. I would much rather have 2, 3, 4 million hits on good nutrition, how to prepare meals on a budget, than anything else that we do. So, congratulations again to you all for doing that, and for the communications teams for making that happen. That's the kind of innovative things that we need to be doing, and we are doing. And we shouldn't be shackled in a job where we're doing the same thing every day when we can help people in a different way. So, Lisbeth, let me move over to you. We talked early a bit about the growing season in New York. What does SNAP Ed do on gardening?
Well, some of our regions distribute what we call SNAP Ed container garden kits. The nutrition educators, the local nutrition educators, help older adults grow their own herbs and vegetables in containers. Our educators help the older adults by providing the seeds or seedlings and information on how to grow the plants, as well as how to use what they grow in healthy recipes. And one of the reasons our program does this is to let older adults know that the seeds for those kinds of plants can be purchased with SNAP benefits, which is really cool.
Yeah, and can you throw up a couple more of those pictures again, Alex? I mean, again, these are not stock pictures. These is things that are happening in New York State because of this amazing partnership with OTDA and the wonderful work that we have with our 4 nutritionists and Tianna. It's incredible. It's incredible. Does anybody? Oh, go ahead. I'm sorry.
No, I was just going to say it's a great popular program that we have.
It's great. Has anybody ever heard of MyPlate? Well, if you haven't, check this out.
Hi, eat right. MyPlate is a nutrition guide developed by the USDA to help you find your healthy eating style and maintain it for a lifetime. A healthy eating routine is important at every stage of life, from childhood to adulthood, and can have positive effects that add up over time. Eat a rainbow of colors by making half your plate fruits and vegetables. This includes fresh, canned, or frozen. Vary your protein routine. Make half your grains whole grains. Move to low-fat or fat-free milk. choose foods and beverages with less added sugars, saturated fat, and sodium. Find your healthy eating style and maintain it for a lifetime. Visit snapedny.org for more information, tips, and recipes. Save time, save money, eat healthy.
Yes, those are the core messages of SNAP-Ed.
I love those core messages because they're easy to remember. And hopefully people think of them when they're in the grocery store and they're purchasing food. They're going to remember those messages. Oh, that's right. I'm supposed to make half my plate fruits and vegetables. What vegetables am I going to plan on eating this week?
It takes those very complicated nutrition concepts and boils it right down to basic, easy to follow ways of eating healthy.
Yeah,
I love the SNAP-Ed program.
I want to get to a point where we have older adults teaching young mothers how to cook and do exactly for young folks what I think. I grew up cooking because of my grandmother. Many of us have, and it's a fun way to spend time and to interact with my kids, taught them how to cook, etc. Alex, do we have any questions? I saw a couple in the chat, so I have a couple, but I think we have a couple from the audience. Do we not? There we go. How much does a home delivered meal cost?
So each county has different costs associated with them. Obviously, like New York City, the costs are different than upstate. But just like the Congregate meal sites, as we were discussing previously, each home delivered meal participant is given the opportunity to voluntarily contribute towards that service. And like you said, Greg, those voluntary contributions that are collected from participants throughout New York State help to expand those programs in that person's own community. There are other individuals maybe right next door to them who benefit because of those voluntary contributions that are made. However, they are not mandatory and no one is denied service if they are not able to contribute.
Yeah, and I just want to differentiate between the question and the answer. The actual meal cost is not what the voluntary contribution is.
Right.
So if the meal in Albany County cost $8.53, the policy of Albany County might be we're looking for we're asking for, but it's not mandatory, a $2 contribution if somebody can do it, but it's not going to prevent them from getting the meal. So I just want to differentiate that it's not the actual meal cost. It's, if you want to contribute, and most people do, like I said, it generates an additional $16 million. So if you like to do math like I do, take 16 million divided by $8.50. That's how many more meals can be provided across the state. My dad is in his 80s, lives alone, and can't stand long or see well. I stock his freezer with frozen meals when I visit every month. Would a home delivered meal be a better option for him?
I would say in many cases it is. Barriers to cooking, such as not being able to see well or stand for long periods of time, can all mean that someone might qualify for home delivered meals. And certainly the home delivered meals that our participants receive, they have to meet the dietary reference intakes for Americans. And that means they're going to be lower in sodium, lower in fat. They're going to have enough protein in them. They're going to have enough fiber in them. And none of that is guaranteed if you're purchasing ready to eat frozen meals. Now, that's not to say that you can't eat those types of things, because you can, but over the long term, the home delivered meals oftentimes are more nutritious than something that you're going to purchase already made from a grocery store.
Yeah, that's a great answer. And I would say to the gentleman that asked that question, thank you for helping your dad out by doing that. And I think that those meals that you're providing for him would be a great supplement to a home delivered meal. And what Wendy's really saying is that our meals are required, which is why we have registered dietitians, to meet the highest national standards. So I think that's great. Let me ask you guys, because we didn't talk about this. How many meals do people get a day?
Usually, yeah, go ahead, Tianna.
It varies. Greg, the reality right now is that in most cases, AAAs are able to provide 1 meal a day for home delivered meal participants for the days they need them. For some people, that might include the weekends, which might mean that on Thursday they get 2 meals, one of them being a frozen meal for Saturday, and on Friday they get 2 meals, one of them being a frozen meal for Sunday. Less often now, because really of our kind of funding crisis for meals, where costs are going up and the funding is not. AAAs are finding themselves unable to provide for 2 meals a day. But years ago, that was much more common, where the meal delivery would be 2 meals. It would be a hot meal ready to go right then for lunch, and maybe a chilled meal or cold meal bag dinner for later. Like the heavier meal would be the lunch meal, and kind of the lighter meal would be the dinner meal. But that's not as common these days, unfortunately, Greg. And like you said, sometimes that means then like family has to help out with what that older adult is going to have to eat for the other 2 meals a day, their breakfast and dinner.
Yep, and that's exactly why I asked the question. So the gentleman that's helping his dad in the 80s, continue to do that. And for anybody that's watching, if there's an older adult that you know that's receiving a home delivered meals and there's assistance you can provide, either through a donation directly or even through volunteering, always looking for more volunteers, reach out to your local office for the aging. Again, that's what a AAA is, but we'll call it a local office for the aging. So you don't wind up, getting a map to Florida at the Automobile Association. Do we have another question? How do I find the nearest congregate dining site location? I think we answered this, but let's do that again because it's really important.
Yep.
And I'll take that, Greg, and I'll say you want to contact your local office for the aging. And you want to do that on really whatever you're seeing on the screen here. So our website can navigate you to the contact information for your local office, or really easy to call the New York Connects phone number. Just think for a moment before you call about what county you live in, because a lot of people know what town they live in, what city they live in, but some people aren't kind of as fluent in the name of the county they live in. So think about that for a moment, and then that will automatically route you to the county office for the aging that can serve you. And then you describe to them, you live near the library or you live near the town hall, like where are congregate sites. And they'll also explain to you, sometimes there is a site near you that will be open Monday through Friday for lunchtime. And sometimes a site near you might be like a Tuesday, Thursday site. And then there's another site kind of in the other direction from you that might be Monday, Wednesday, Friday. So it varies, area to area. That's why you really need to talk to the locals, not to us, because it's all unique.
Yeah, and I think that's really good advice because, again, not every congregate meal site is in a senior center. And I'm going to go back to this again. A senior center is not always what you think it is. So don't be afraid to walk in and see what it looks like. You can just walk in and talk to folks. But there are other places that you can get a congregate meal. And I'm going to ask you guys, again, we didn't talk about this, but you know the answer. Since the pandemic, we've adjusted a little bit our nutrition program. Now we have something called Grab and Go. Tell me what that is.
Can I take that, Wendy? Is that
Yeah,
okay?
go ahead.
I also wanted to point out, Greg, in the same vein, since the pandemic, we've also really grown our restaurant dining program. So those are 2 really cool new options available to a lot of folks around the state. So Grab and Go, and I like to call them portable meals, because no longer do you need to grab the meal and flee from COVID and go back home, but you can take that meal just like, you go into another dining establishment and you decide, I don't want to sit here and eat today. I want to go sit outside in the park in the sun, or, I want to go get 2 meals and be able to bring one home to someone who isn't up to going today. So that is the really nice kind of empowered flexibility that we're offering, where it might be that you really want to sit at the congregate dining site and eat, and it might be that for a number of reasons on that particular day, that is not what you're going to choose to do. And you could take the same exact meal and go to another location. And, these days people work longer. People are caring for their grandkids, that you might have to take that meal and go back to work. So it just really helps us serve more people. And the restaurant dining program is a version of the Congregate program, but there are set menu items at the local restaurant that have been approved to meet all the same nutrition requirements that we would have at our Congregate meal site. But you get to go more when you want and have more choices off of a menu. But same principle applies in terms of the voluntary contribution. So again, affordability is not a barrier.
Yeah, and I think I like the word portable meal better. Obviously, during the pandemic, everything was shut down, including the congregate sites. And I remember for a March for Meals event we did early in the pandemic, and I want to thank Holly Rhodes Teague from the Suffolk County Office for Aging. I was delivering portable meals, and they were extraordinarily popular, but just how grateful people were that they weren't going hungry at a time where, grocery stores didn't have food, you couldn't go out. People over 75 were told to stay at home. It was literally a lifeline. I think we have time for one more question. When I was in school, we were taught the 4 food groups. Yep, that is true. Then there was the pyramid and a plate. How are we supposed to know what to eat anymore?
Well, SNAP-Ed uses MyPlate to explain nutrition. It's evolved into something that's very practical and very easy. The pyramid was a little complicated. The 4 food groups, there's really more like 5. But the MyPlate, I've been a dietitian for a very long time, and MyPlate is probably the best way to identify what you should eat, in my opinion. I don't know. Yeah. Wendy, what do you think?
What I go back to, because I do hear that complaint from people quite often, and nutrition information does change because it is a science, and we do, studies on an ongoing basis. Unfortunately, the study that showed that people who drink red wine, were healthier than other people. It turns out that was due to income factors and things like that. It was wishful thinking. So we do studies on an ongoing basis, and sometimes they go, oh, what we thought before, that's not true anymore. So I always go back to, well, what's the one message that hasn't changed? Yeah. And that message is eat more fruits and vegetables. That has not changed in my lifetime. So if you take nothing else away, as Tianna said earlier, most Americans don't eat enough fruits and vegetables. And that continues to be true. So eat more fruits and vegetables.
Go ahead.
Yeah, fresh, frozen, dried, or canned, doesn't matter. You can eat canned vegetables completely fine. I find way more low sodium or no sodium added varieties in the store now than I did, 5 or 10 years ago. Frozen fruits and vegetables are wonderful. Go ahead, Lisbeth.
No, I was just going to say the same, just reinforcing what you said, Wendy, that, we're not so picky about which fruits and vegetables you eat, just as long as you eat plenty of them. And there are more reasonable ways to get fruits and vegetables into your diet. Frozen vegetables are huge. I grew up eating them, and I use them all the time at home because they're convenient, they're budget friendly, And again, if I pick one thing to focus on for nutrition, it's my own goal is to eat more fruits and vegetables.
That's great. Well, thank you guys. I'm going to wrap up by saying this. March is National Nutrition Month. That's the second time I said that. But the issue we're talking about is a 12-month-a-year issue. This is an opportunity for us to highlight the largest nutrition program in the country, which is ours, but there's a lot of need out there, whether it be making a donation to your Office for Aging so that they can provide more meals, whether it be volunteering to be a home delivered meal driver or work in a congregate setting. If you know somebody that's utilizing these programs, you know what the benefit is. So, think about this. So we talked a little bit about hunger and malnutrition, and it's a real issue for some older adults, not all, but those are the people that we're targeting. So I really want to thank Tianna, Wendy, Lisbeth, as well as Jennifer. This is a really important issue, and we take it really seriously, and we're really proud of the work and the partnerships that we've developed, not only at the state level, but the local level. Join us next time. We're going to talk more about the paid family leave program that we have in New York State, which is really a nation-leading program. And as always, I want to thank our communications team, Roger and Darren, for their support, and Alex for making this production possible. So thank you all so much, and we'll see you in a couple of weeks.
Hi, I'm registered dietitian Wendy Beckman, host of What's Cooking with NYSOFA. Over the past 2 years, I've had the opportunity to share healthy, nutritious recipes with you on the show. I work for the New York State Office for the Aging, and thanks to a partnership with SNAP-Ed New York, our nutrition team reaches hundreds of thousands of older New Yorkers each year. So why a cooking program? 60% of health costs and related issues have nothing to do with health, but instead have to do with individual behaviors like our food choices and physical activity. The recipes we feature are nutritionally appropriate for older adults, meeting critical nutrition requirements for healthy aging. What I bet you don't know is that this show is only part of a larger effort. To help me explain what our nutrition team at the New York State Office for the Aging does and what a registered dietitian is, here is registered dietitian Lisbeth Irish.
A registered dietitian is a professional who has training and education in food and nutrition. To become an RD, you must complete certain requirements, including a minimum of a bachelor's degree from an institution that's accredited by the Academy of Nutrition and Dietetics. You must also pass a national examination and meet continuing education requirements. What does that mean? As RDs, we are qualified to offer accurate advice about nutrition, and we can help answer your questions about how diet can affect your health. At NYSOFA, the registered dietitians handle many tasks. This includes hosting 2 online programs aimed at helping older New Yorkers make better nutrition choices. These programs are What's Cooking with NYSOFA, which is our monthly cooking demonstration, and a Facebook Live program that I host called Ask the Experts, Nutrition Edition. In the months ahead, be on your lookout for it. We'll be sharing your questions and our experts' answers about nutrition and health. New episodes of Ask the Experts Nutrition Edition debut the second Friday of each month on Facebook and YouTube.
As Lisbeth explained, registered dietitians at NYSOFA handle many tasks, including food safety at congregate meal sites, educational materials, and outreach. In the meantime, please don't miss an episode of either show produced by our team, What's Cooking with NYSOFA and Ask the Experts Nutrition Edition. Every episode is uploaded to YouTube, and you'll find the archive shows there.
Do you have a question about foods? Or do you have a particular health issue that you'd like to improve by changing your diet? Tune in to Ask the Experts Nutrition Edition every second Friday at 1 p.m. We'd love to hear from you.
Remember, registered dietitians are the experts in nutrition. Visit for more sound advice about eating healthy on a budget.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau.